my book review on Dying for a Chat, The Communication Breakdown Between Doctor and Patient, published in 2012, written by Dr. RANJANA SRIVASTAVA, a medical oncologist, an educator and an award-winning writer. She delivers her services in Melbourne's public hospital. It's her second book after Tell Me the Truth, and she also wrote A Cancer Companion. She plays a critical role in training the skills of communication between doctor and patient, which is clearly reflected in her book. She depicts the scenario of healthcare system. This book is about 90-year-old Mrs. Johnson and several other patients facing services consequences. Dr. Srivastava touches three corners: medicine, humanity, and ethics. She concentrated on doctors who opens unstoppable treatment option without knowing one's comfort, and on unconfused patients who are undergoing unnecessary interventions in the form of medicines and interventions and investigations ultimately end up in losing their lives. Author also tells about how over-specialization and fragmentation has created complications in seeking care. Also mentioned about role of bureaucrats and their design hierarchy to practice medicine. And lastly covered evidence-based best practice and guidelines for future aspects. Now, core issues. Lack of communication and miscommunication. This resulted in negative and painful outcomes, as explained in Mrs. Johnson's case, who never wanted fussy or agitated treatment, as she saw in her husband's case. But nobody bothered to know what did she want in her end-of-life situation. Miscommunication created by persuading false feedback to her family members that she will be alright. Endless medications and treatment were tried, and lastly, to revive her from sequential order of complications, she got admitted to ICU, from where she never came back. Ultimately, Mrs. Johnson suffered, who never wanted to die like this. Dr. Srivastava also explains how miscommunication between doctor led Mrs. Johnson to lose her life. Ha and Longnecker suggests the significance of doctor-to-patient relationship is directly proportional to outcome of disease. Doctor should completely know the discomfort of patient, and also explains entire treatment plan with its prognosis. Norton also share valuable information on study conducted on 89 patients during their discharge at US hospital, where only 18% of patients were knowing their doctor name and 77% were unaware of their diagnosis. On the other hand, interviewing 43 physicians, 2/3 assumed that their patients already know their name, and 53% pre-assumed that patients were aware of their diagnosis. Another figured evidence by Mitch Sang, in America about 200,000 deaths were reported due to misdiagnosis of the care. This attributes to root cause, that is lack of communication in busy practice. The increasing issue of aging in Australia is another concern. Evidently, there will be a higher prevalence of several diseases per individual. Looking at present understaffed and overloaded condition, this alarms healthcare system to take initiatives to manage the future scenario of healthcare system. Mrs. Johnson admission to ICU is expressed as futile attempt and a missed opportunity for someone who really needed a bed in ICU. Intensive care was provided due to a fear of lawsuit. This way, it will be difficult to accommodate every patient who genuinely need intensive care. Mrs. Johnson urged to clear her overflowing bedpan to become comfortable. This explains the carelessness, or we can say consequence of overload of patient with understaffed situation in healthcare system. The trend of pursuing specialization in order to compete among peers with a belief of achieving better practice than GPs has led to fragmentation within medical system. This makes patients to visit several doctors for their each symptom diagnosed. Thus, patients seek over-treatment under uncoordinated care system, which also increases cost of care. No one doctor can address the patient as whole in first instance, which creates frustration in patient at end-of-life situation. Dartmouth Atlas study states the more precise treatment you get does not mean it will yield you with better outcome. Mrs. Johnson sacrifices her life just because of her medical scripts, which were overlooked by several specialists, resulted in drug interaction leading to renal failure followed by heart attack. Stein shares that fragmentation in healthcare system does not heal the sufferer. Instead, the most profitable brand of medicine is sold out without taking effect of medicine into consideration. Now, It's not about healing patient anymore. It's about selling the unnecessary treatment option and neglecting degree of outcomes. Murray and Clendon also agrees, saying fragmentation has deviated the path of medicine to an atomistic or inappropriate way. Authors showed concern for unrealistic and non-evidence-based practice of prescribing antibiotics in patients with sinusitis. This would develop community resistance in future. The deficient awareness and inappropriate internet knowledge develop patients' expectations to be prescribed by medicine. On the other hand, doctor cannot afford losing patient, so they have to prescribe, for example, unnecessarily antibiotic in sinusitis. Right of ordering number of diagnostic tests does not mean one should overprescribe the investigation tests. A 70-year-old man diagnosed with stroke was entitled to get MRI after his clear findings on CT scan, just because it is an investigation tool. In order to get MRI of claustrophobic patient, he was sedated. As a result, got his hip fractured and lastly died due to hospital-acquired pneumonia. Over-investigation was paid at the cost of his life. In the counterpart, self-diagnosis after searching from internet by the patient and further demand of specialized treatment is also a big concern. For example, a man with symptoms of shortness of breath went willingly through several unnecessary tests for his already diagnosed problem of being overweight. This overconsciousness and lack of self-recognition dragged him to experience misadventures in his life, from CT scan-induced allergy to back injury during cardio test. Ultimately, he was assessed with dementia, due to which he lost his family support and was left alone in nursing home. Midsang relates this as hazard of miscommunication, which led patient to find information on internet for better care. Murphy termed cyberchondria as a result of unfathomable information from internet causing anxiety-related self-diagnosis. Murphy agreed on the point that unsorted information on the internet causes medical condition known as hypochondria, in which patient becomes suspicious towards the advice given by physician that there is no such intense treatment required. The highly demanding relationship between doctor and patient is at stake of several concerns regarding public health, emotional ties, and mental satisfaction. This raises several questions on both doctors and patient. In this book, Dr. Srivastava has converged these several problems within healthcare system into one root cause, that is communication breakdown between doctor and patient, traveling through consequences of unethical practice with increased workload and understaffed hospital to endless investigation and their endless consequences faced by patient creates difficulties in accommodating every patient. The increasing trend of granting specialization increased chances of miscommunication, as one individual is guided by several specialists without looking at each other's treatment protocol. The ongoing inbuilt defaults within healthcare system is growing faster without realizing the actual effect on patients on humanitarian grounds, and the same will be passed to new doctors. Appreciating authors' recommendations regarding inclusion of communication skills in doctors' curriculum to squeeze the communication gap. Treatment to be patient-centered, knowing what the patient wants at his end of life. Also mandating checklist to increase the communication between doctor and patient. Best practice begin with the team work. Questions arise in my mind. Why can't a single doctor advise right treatment option? Why not an incentive is provided in delivering the quality of care? Who knows?